Important notice. This video is provided for informational and educational purposes only. It does not substitute professional medical advice.
Did you know that cholera is a serious disease, but it can be prevented if identified in time? It has affected millions of people around the world, and while it is more common in areas with poor sanitation, it can arise anywhere. Today, we will discuss the 10 most important symptoms of cholera so that you can recognize the signs and seek help immediately. Stay tuned until the end, as cholera can progress rapidly and in some cases be fatal. Don't forget to like this video and subscribe to the channel for more informative content like this. Cholera is an acute bacterial infection caused by Vibrio cholera, primarily transmitted through the ingestion of contaminated water or food. Its main symptoms include intense watery diarrhea and rapid dehydration, which can lead to death if not treated quickly. The disease is more common in areas with inadequate sanitation, and treatment includes immediate rehydration, either orally or intravenously, along with antibiotics in some cases. Prevention involves access to clean drinking water and good hygiene practices. 10 symptoms of cholera. Severe watery diarrhea. The first symptom of cholera is severe watery diarrhea, which can occur suddenly and lead to rapid dehydration. This type of diarrhea is often described as rice water due to its clear appearance with small white flecks, similar to the water in which rice has been washed. Diarrhea caused by cholera can be very intense, with an infected person losing large volumes of bodily fluids in just a few hours, resulting in serious complications if not treated. This rapid fluid loss is what makes cholera extremely dangerous, as without proper rehydration, it can lead to shock, organ failure, and in extreme cases, death. Immediate treatment is crucial. 2. Vomiting. The second symptom of cholera is vomiting, which usually occurs alongside severe watery diarrhea. Vomiting can begin suddenly, even without prior signs of nausea, further contributing to rapid fluid loss from the body. Like diarrhea, vomiting in cholera can be abundant and frequent, accelerating the dehydration process. This significant loss of fluids and electrolytes can worsen the patient's condition, leading to symptoms like extreme weakness, dizziness, and a drop in blood pressure. It's essential to treat vomiting promptly with oral or intravenous rehydration solutions to prevent serious complications like hypovolemic shock and organ failure. 3. Rapid dehydration. Rapid dehydration is one of the most dangerous symptoms of cholera, resulting from the intense fluid loss caused by severe watery diarrhea and vomiting. In just a few hours, the body can lose a substantial amount of water and essential electrolytes like sodium, potassium, and chloride. This leads to signs such as extreme thirst, dry mouth and skin, decreased urine output, sunken eyes, and intense weakness. In more severe cases, dehydration can cause muscle cramps, mental confusion, and a sharp drop in blood pressure, evolving into shock. Without urgent and proper treatment, severe dehydration can be fatal, highlighting the importance of immediate rehydration with oral or intravenous solutions. 4. Muscle cramps. Muscle cramps are a common symptom of cholera, resulting from excessive loss of electrolytes, especially sodium, potassium, and calcium, during intense episodes of diarrhea and vomiting. These substances are essential for proper muscle function, and their rapid decrease in the body leads to painful muscle contractions, especially in the legs, arms, and abdomen. The cramps can be intense and debilitating, exacerbating the patient's feelings of discomfort and weakness. In severe cases, these cramps indicate that the body is suffering from profound dehydration, requiring immediate replenishment of fluids and electrolytes to prevent more serious complications like shock or organ failure. 5. Dry and wrinkled skin. Dry and wrinkled skin is a characteristic sign of severe dehydration in individuals with cholera. When the body loses large amounts of fluids and electrolytes through diarrhea and vomiting, the skin begins to lose its natural elasticity. This causes the skin, especially on the hands and face, to appear dry, wrinkled, and less flexible to the touch. This symptom results from a drastic reduction in water levels in body tissues, compromising the skin's ability to maintain proper hydration. Wrinkled skin is a warning that the body is critically low on fluids, and immediate replenishment is essential to avoid even more severe complications. 6. Rapid heart rate. A rapid heart rate, also known as tachycardia, is one of the symptoms of cholera and occurs due to rapid dehydration caused by excessive fluid and electrolyte loss. When the body is dehydrated, blood volume decreases, forcing the heart to beat faster to ensure oxygen and nutrients continue to be delivered to vital organs. This response is the body's mechanism to compensate for the drop in blood volume. However, if not treated quickly, it can lead to more severe complications like heart failure. Tachycardia is a sign that the body is in a state of maximum alert, and fluid replacement is urgently needed. 7. Low blood pressure. Low blood pressure or hypotension is a critical symptom of cholera directly linked to severe dehydration. As the body loses large quantities of fluids through diarrhea and vomiting, the circulating blood volume also decreases drastically. As a result, the heart struggles to pump blood effectively, causing blood pressure to drop. This symptom is dangerous because, with very low blood pressure, vital organs like the brain and kidneys do not receive enough oxygen, which can lead to shock, organ failure, and even death if treatment is not initiated immediately. 8. Dizziness and weakness. Dizziness and weakness are common symptoms in cases of cholera, especially due to severe dehydration. When the body loses large amounts of fluids and electrolytes through diarrhea and vomiting, the circulating blood volume decreases, directly affecting blood pressure and the oxygenation of organs. Consequently, the brain does not receive the adequate amount of blood and oxygen, leading to feelings of dizziness, imbalance, and even fainting. Generalized weakness is another consequence, as the lack of fluids and nutrients weakens the muscles, leaving the person unable to perform simple tasks or even stand. These symptoms require immediate attention to prevent serious complications. 9. Scant or absent urine. Scant or absent urine is an alarming symptom of cholera, reflecting the severity of dehydration. During a cholera episode, the body loses large amounts of fluids due to intense watery diarrhea and vomiting. With the significant loss of fluids, the kidneys, which regulate urine production, begin to conserve water to maintain blood pressure and bodily function. As a result, the amount of urine produced decreases drastically, potentially leading to anuria, which is the complete absence of urine. When present, urine may appear concentrated and darker in color, indicating severe dehydration. The reduction in urine production is a critical sign that the body is in a state of emergency and needs immediate rehydration, either orally or intravenously, to avoid kidney damage and potentially fatal complications. 10. Hypovolemic shock. Hypovolemic shock is a severe condition that can occur in advanced cases of cholera, resulting from excessive fluid and electrolyte loss. This critical situation manifests when the circulating blood volume in the body decreases to such an extent that vital organs do not receive enough oxygen and nutrients. In the context of cholera, severe dehydration caused by intense watery diarrhea and vomiting leads to decreased blood volume. Signs of hypovolemic shock include pale and cool skin, rapid breathing, accelerated heart rate, and mental confusion. Patients may experience extreme weakness, dizziness, and fainting. If not treated quickly, this condition can lead to multiple organ failure and death. Immediate treatment is essential and involves aggressive rehydration with intravenous fluids and, in some cases, blood transfusions to restore adequate volume and stabilize blood pressure. Early recognition of hypovolemic shock is crucial for survival in cholera situations. These are the 10 most important symptoms of cholera that you need to know. If you or someone you know exhibits these signs, it is essential to seek medical help immediately. Cholera is a serious disease, but it can be treated and prevented with proper hygiene and hydration measures. Do not underestimate the signs of dehydration, and at the first hint, seek care. Prevention and early treatment can save lives. If you found this video helpful, please leave a like and share it with anyone you think might need this information. Don't forget to subscribe to the channel for more health tips. Taking care of your health and the health of others is a responsibility we all share. See you in the next video.